Hello, my name is Dr. Robert Mihalich, and I would like to present a general overview of what to expect when undergoing knee arthroscopy with me. Knee arthroscopy is one of the most common orthopedic surgeries performed in the United States. It allows surgeons to use small incisions to access the joint in order to treat problems like meniscus tears, removal of loose bodies, and treatment of cartilage damage. There are typically two small incisions made for this procedure. There is one for the camera and one for the tools that help fix the problem. Pictures can be taken of the inside of your joint and shared with you at your postoperative visit. There are typically no weight-bearing restrictions after surgery, but it is important to make sure you can rest and limit activities for the first few days after surgery. In general, there is nothing to damage after the surgery, but the knee can become aggravated, which will delay your recovery. Preparation for time off work is essential to minimize the chance of delay in benefits. Return to work is based on ability to safely perform and tolerate your job. Typically, desk work will require only 1 to 2 days off, while labor-intensive jobs may require 4 to 6 weeks. On the day of surgery, plan to come in 1 to 1.5 hours prior to surgery in order to meet with anesthesia and get set up with an IV. Anesthesia is usually general with local anesthetic injection around the incision sites. Spinal anesthesia is an option, and the anesthesiologist can discuss the risks and benefits of this type of anesthesia with you. I will meet with you to mark the site and answer any last-minute questions prior to the surgery. The surgery will generally last no more than 30 minutes. The details of the procedure will vary depending on the problem and will be thoroughly explained at your preoperative visit. Most procedures involve cleaning up the joint and not specifically repairing anything. There will be a dressing and ACE wrap on your knee after surgery. No brace is typically needed. Once your pain is controlled and you are moving safely, you may go home, usually 45 minutes to 60 minutes after the surgery. It is okay to weight bear as tolerated. Crutches or a walker are only needed for as long as it takes you to be safe and stable. Frequent icing, elevation, and use of pain medications as needed will minimize the discomfort after surgery. A tourniquet is used for control of bleeding during the procedure. It can result in some thigh soreness and sometimes bruising that typically resolves in a few days. The bandage should be kept intact for 2 days as there is direct access to the knee joint, and we want this to seal up. Wrapping the area with a plastic bag or saran wrap will be necessary if showering. After 2 days, the bandage may be removed and waterproof band-aids applied to the incisions. When the band-aids are in place, you may shower without covering it. Follow-up will be 10 to 14 days after surgery. Sutures will be removed and advancement of activities will be discussed. Physical therapy is indicated for patients who wish to progress faster back to functional and recreational activities. There are generally no restrictions to progression of activities, but as all patients are different, some people will progress faster than others. Swelling and stiffness is expected after surgery and is normal for the first few weeks. If thigh soreness occurs due to the tourniquet, symptoms can be controlled with ice or heat as well as anti-inflammatories. Most patients will follow up again at 4 to 6 weeks after surgery to assess your progress. If it is slower than desired and you have not started therapy, it will likely be recommended. The presence of arthritis in the knee may limit the relief of pain achieved by the surgery, as the only way to cure arthritis is a knee replacement. Knee arthroscopy does not address arthritis. If there are symptoms from arthritis, a series of injections with a substance called Supartz or hyaluronic acid may be recommended. These can help with the symptoms of arthritis and can last 6 months to a year. You may return to all activities as tolerated. Typically, less impact activities such as swimming and biking will return first, followed by walking, elliptical, and running. Swelling is the last symptom to resolve and is expected and not a cause for concern in most cases. If the swelling is limiting progress, an anti-inflammatory medication or sometimes drainage of the fluid is recommended. Recovery can be variable from patient to patient, and some will feel better within 1 to 2 weeks, while others may take upwards of 8 weeks for pain and swelling to completely resolve. I hope this provides some insight into what to expect when undergoing arthroscopic knee surgery with us. Please know that we will be with you every step of the way.